The Higo Pro Device is a versatile tool with 5 exchangeable modules designed to simplify and streamline various medical examinations. Follow these clear and detailed instructions to ensure the proper use of each module. Temperature exam. This exam may look a little different than what you are used to. Attach the thermometer module to the device. Position the thermometer on the center of the forehead. Press the start button and slide it towards the top of either ear while maintaining continuous skin contact. After a second, the results will display on the LCD screen. Start in the middle of the forehead and slide to either ear. Maintain contact with the skin during the scan. Heart rate exam. Here is where you measure the heart rate. On the left side of the chest, close to the sternum and not on the sternum. This point is called the Herb's point. After the heart rate is measured, the exam ends automatically. Attach the stethoscope module to the device. Place the stethoscope on the left side of the chest, near the sternum, at a point known as Herb's point. Perform the exam in a quiet environment. Avoid placing the stethoscope on the sternum. Heart auscultation exam. The heart is situated in 4 points. The first point is on the right side of the chest. It is important to not place the stethoscope against the sternum, the line in the middle. Attach the stethoscope module to the device. Examine 4 points around the heart, starting with the right side of the chest. Make sure to place the device next to the sternum and move on to the other points. Conduct the exam in a quiet environment. Avoid placing the stethoscope on the sternum. Lung auscultation exam. Lungs are examined in 12 points, 6 on the chest and 6 on the back. During the lung exam, the patient should breathe in deeply through their mouth. Be sure to place the stethoscope on the chest in either of the 12 points and avoid the shoulder blades. Placing it on the ribs is best. Attach the stethoscope module to the device. Examine the 12 points on the chest, 6 on the front and 6 on the back. Instruct the patient to take deep breaths through their mouth. Perform the exam in a quiet environment. Ensure the stethoscope is placed correctly. Prompt the patient to breathe deeply. Do not place the stethoscope below the ribs. Cough exam. There are several types of coughs, and as soon as a doctor hears it, they can immediately diagnose it. Attach the stethoscope module to the device. Record the patient's breath or cough by pressing start on the LCD. Hold the device close to the face but slightly to the side to avoid obstructing the cough. Ask the patient to cough 3 times. Do not place the stethoscope directly in front of the mouth. Ensure the patient coughs 3 times. Abdominal exam. During the consultation following the auscultation points 1 and 2 as displayed, it is important to be as precise as possible when placing the stethoscope. The exam is completed after you have recorded both auscultation points. Attach the stethoscope module to the device. Perform auscultation at points 1 and 2 as displayed. Ensure precise placement of the stethoscope. The exam concludes after recording both auscultation points. Conduct the exam in a quiet room. Place the stethoscope on the correct points. Skin exam. Sometimes allergies show up on the skin. This is important information for a doctor. It is important to not only show the lesions but also the area surrounding them. This information will allow your doctor to make the correct diagnosis and prescribe the correct treatment. Attach the derm hood module to the device. Ensure the module's edge makes direct but gentle contact with the skin without applying excessive pressure. Press the start button and move the device over the affected area. Stop after recording all areas of concern. Throat exam. Attach the module with a spatula to the device, choosing the correct spatula size, S for children up to 5 years, L for older children and adults. Tilt the patient's head back slightly for comfort. Place one hand on the patient's lower jaw to stabilize the head. Ask the patient to open their mouth widely and say, "Ah." Place the spatula on the tongue, ensuring it covers the uvula, the back of the throat, and the palatine arches. The exam concludes once all 3 areas are in view. Tilt the patient's head back slightly. Place the spatula up to 3/4 of the tongue's length and press firmly. Include all 3 designated areas in the examination. Ear exam. Ear exams are simple with Higo, and if done correctly, you won't hurt anyone by performing this exam. Attach the otoscope module to the device and secure a disposable speculum. 2.5 millimeters for children up to 3 years, 4 millimeters for older children and adults. Instruct the patient to sit up straight and tilt their head to the side for comfort. Hold the device like chopsticks, with your thumb on top and fingers on the bottom. Press the start button once the device is in a comfortable position. Gently pull back the patient's ear to expose the ear canal. A well-performed exam should reveal the eardrum with a light reflection.